Good morning, Carol. Thank you very much for joining us today.
Thank you for having me here.
We're excited that you're going to be talking to us today about Parkinson's disease and why you're speaking out about the topic. Why specifically did you decide to join us this morning?
I felt very strongly that after my husband's death, I wanted to reach out to other caregivers who were going through similar symptoms that we had. Parkinson's disease has an element of Parkinson's dementia that occurs in about 40% of the cases, and we as caregivers usually are unaware that that's a possibility.
When did you learn that your husband had Parkinson's disease?
Clarence was diagnosed with Parkinson's disease for 17 years, and it was the last 3 years of his life that we were aware he had Parkinson's dementia.
Okay. How did you and your family prepare for the Parkinson's psychosis and dementia?
Actually, we did not prepare because we didn't know to prepare. As a nurse, I did not realize that was a possibility, and my husband was a physician, and he didn't realize that that was a possibility. So we really didn't have a chance to prepare, and that's one of the things that I'm very angry about and very much want to get across to other caregivers, that this may not occur in your case, but there is a 40% chance that it will occur.
So you just mentioned that by training, you're a nurse and your husband was a physician, and you're telling me that neither of you were prepared for the psychosis side of the disease. So at what point did you start noticing that changes were setting in and these mental impairments and behavioral changes were happening, and how did you realize that this was something different, if you will?
My husband retired in 2004, and the following year he was home all the time, and I noticed little insidious things were occurring, like he would be hunting for words. He had trouble putting sentences together. He would forget things. He couldn't remember lists. If you told him to do so or asked him to do something, you could only do one instruction at a time. And so I suspected then, within 6 months, it was quite obvious that he did have dementia.
So is it safe to say, too, that he had the movement disorders with the disease along with these mental impairments and behavioral changes?
Yes, I think that's correct, which makes it harder from a caregiver standpoint because you're dealing with severe physical restrictions and trying to keep them safe from that aspect so that they're not falling and that they're able to swallow their food. But then you combine that with the dementia where they can't follow instructions, where you ask them to sit still and they get up immediately and fall, and they're not able to make that association. If I get up, I will fall. They just know that they're going to get up.
We've seen that many of these patients have hallucinations, illusions, and delusions. Can you talk to me a little bit about that and what you and your family experienced?
In my case, or in Clarence's case, that was really I would say the last year that we had problems with the delusions where, he was afraid things were going to hurt him. So he spent a lot of time being very terrified. He would see things, he would imagine that we were places and we were at home. And as hard as it is for me, I also know that he struggled with that, and the fear and the stress that he went through was significant.
We understand that there's no currently FDA-approved drugs for this disease, so how was Clarence treated?
That's my understanding currently, and in Clarence's case, we were treated with approved drugs for psychosis that are out on the market now. The drawback to that is those very drugs may actually exacerbate or increase the symptoms of the Parkinson's, or they make the Parkinson's drugs less effective. The patient also becomes refractory to those very soon, and they don't help. The most you can hope for is a temporary sedation for 2 or 3 hours from them.
Were there any other options for you and Clarence in terms of treatment at the
No,
time?
at that time there were no other options available to us that we were aware of. Now there is a great deal of research going into Parkinson's and Parkinson's dementia. There are clinical trials that are out there, And I would strongly encourage patients to consider that and become a part of a clinical trial. There's a drug being tested now for Parkinson's dementia. And if anything can help you, then you need to take this, directly on with your physician. You need to say, how do I become part of this? If they don't know, then you need to get on some of the websites and find out how to be part of this.
If that was available to you and Clarence a few years back, is that something that you would have participated in?
Clarence and I, both being in the medical field, would have not hesitated at all to participate in a clinical trial. Patients on clinical trials have a lot of advantages. They're monitored more closely. They have direct access to physicians and other people in the community, the Parkinson's community. You can form friendships and associations with other people on the study. And you have access to a drug that you might not be available to you for several years. But I think the fact that they're monitored and the services, you get many more services and you're not paying for those, I think it's a win-win situation.
Carol, it's been almost a year now since Clarence has passed, and you're still out there advocating for additional things for these patients and caregivers. What do you think is the most important message you would like to make today to those listening and watching?
The most important things I think you need to know as caregivers is the dementia in Parkinson's, the Parkinson's psychosis can be as high as 40%, and you have no way of knowing. There is no test to determine whether or not your loved one's going to get it. I want caregivers to understand that there are other people going through this and that there are support systems there to help you.
Terrific. We're going to go ahead and take a call right now from Los Angeles, California. And I understand that on the line we have Catherine Martin who's joining us. Hello, Catherine.
Hi, how are you?
Hi, Catherine.
Hi, nice to talk to you.
Go ahead, Catherine, with your question.
I have a question for you. I'm caring for somebody with kind of the same health problems, and I know of many clinical studies, but I'm not sure which one is right to choose, and I'm not sure if I should enter one. What would you suggest in your experience?
In my experience, all clinical trials have some definite criteria that has been set up in order for the FDA to eventually evaluate those. So I would suggest, first of all, discussing it with your physician, asking him about the clinical trial, how do you become part of that, and understand that you may not qualify for that clinical trial, or your loved one may not, but at the same time, inquire. You as the caregiver have the potential to make these decisions, and you are the one that needs to ask the physicians the questions. Formulate your questions. Don't be afraid of the physician. Ask them what you need to know to better care for your loved one.
Great. What would you like to see happen within the next 1 to 5 years with regard to Parkinson's and research? What do you hope is going to happen with all of this?
What I hope happens is they announce a cure tomorrow and nobody has to go through this terrible, terrible thing again. What I would like to see in a reasonable time frame that you're discussing is that progress be made in not only treating Parkinson's disease, but the recognition of some of the significant problems that can occur, like Parkinson's psychosis, and also the understanding that the caregiver, the person caring for the patient with Parkinson's, themselves, they have many issues, depression, anxiety, exhaustion, a lot of medical problems that come on. So I think more resources to help caregivers is essential.
And Carol, we have about 20 seconds left here. What's your advice for caregivers at this point in time? Because they go through a tremendous amount of stress and angst. What do you recommend they do?
Caregivers need to understand that they are the ones with the control. They need to make these physicians and talk to them and answer their questions. They need to understand that there are resources and there are things out there to help you. If somebody, and I found this with my husband, friends were always saying, is there anything I can do to help? And you say, I'll let you know. Well, make a list of things people can do to help you. And when they make the offer, say, yes, you can go to this, or you can do this for me. it makes them feel good. They know they're doing something to help, and otherwise they just feel very helpless. So you have to plan ahead, know what you need, seek the help that you need, and get some relief for yourself.
Great. Thank you, Carol, very
Thank you
much
for
for
having
joining
me.
us today.
And I could see all the way to California.